65-year female complaining of breathlessness since 2 years, SpO2 90%, HRCT as follows. What is diagnosis and treatment? HRCT shows bronchial wall thickening, narrowed bronchial lumen, air trapping, mucus flux. Diagnosis is bronchial asthma. Treatment is bronchodilator, steroid, leukotriene antagonist, anti-IgE antibody, mast cell stabilizer. Today drug of discussion is Montelukast. It is leukotriene antagonist used for prophylaxis of mild moderate asthma, not suitable for acute asthma. T1/2 is 3 to 6 hours. Mechanism of action: competitive antagonist of cis-LT1 receptor, leads bronchodilation, reduce eosinophil, reduce sputum production, reduce inflammation. Dose: adult is 10 mg OD. Uses: asthma mild to moderate, allergic rhinitis, hay fever, exercise induced bronchoconstriction. Side effects are rashes, headache, diarrhea. Rare is neuropathy, eosinophilia, mood swings, Churg-Strauss syndrome. Another member is Zafirlukast, which has the same mechanism of action as Montelukast. Thank you. Stay tuned for the next drug of discussion.